what I wanted to talk about today is the different areas that we can work in as therapists, because I feel like that's not a conversation that I had before I got into the field, and it would have been helpful. So I've worked in residential, community outpatient, and I've done contract work for private practice. And I feel like each of these things have pros and cons. And that's what I want to talk about. So that way we can make better choices for ourselves and we can figure out, what type of environment do we really want to be in. So, like I said, I started out in residential, and that was just like jumping into the deep end, honestly, because that was my introduction into this field. And I started out on a crisis stabilization unit. Started out working the unit as a support staff, then case manager, and then I became a therapist. And I feel like this really taught me a lot about how this system works and what I'm able to handle and what I want to tolerate in a job. So let's start with the pros and the cons. I feel like working in residential really showed me how to be creative and built up like my crisis management skills and taught me how to prioritize like just different things and how to prioritize like different types of crises and just different situations. So that was a really big pro because there's always something happening in residential. There's always a fire to be put out. There's just always something. And because of that, you do need to get creative when you're working with these clients and you're trying to do therapy with them because what I learned is that at least the program that I was in and the kids that I was working with that were aged like 6 to 18. A lot of them have been in these programs before. They go from hospital to residential, hospital to residential, hospital to residential. So they can tell you how these programs work better than the staff that work there. And they've been in therapy before. They've had multiple therapists before you, they'll have multiple after you. And because of that, like traditional therapy might not work. They might not even want to be there with you because they're in this environment that they probably don't want to be in, and they have all these other things going on in their lives that therapy probably isn't at the top of the list. So I really had to learn how to build like authentic relationships with these kids and how to allow myself to kind of come out in those relationships too so that way they could feel like they could trust me. And obviously, it doesn't work with every kid. They're not always going to want to talk to you. They're not always going to meet with you. And, that kind of just comes with it and it is what it is. But I learned how to be creative, how to think outside the box, and how to, you know, try different things. And that was really helpful. And I also learned how to be a part of a treatment team. So, like we said, they've been in these programs before. They probably have like a psychiatrist, an outside therapist, a social worker, they have their school, they have, parents or guardians, and figuring out how to be a part of this team that has so many different moving pieces. So that way you can figure out what's my role in helping this kid reach their goal? And how can I coordinate care with all these other parties so that way we're all working towards the same thing? So that was really helpful too. Now, the cons are that residential was stressful. And like we said, there's always a fire, always a crisis, always something. And there's different types of residentials. They all aren't like the one that I worked in. Like there's eating disorder treatment centers, substance use treatment centers. There's, these different types of environments. But the one that I worked in was crisis stabilization. So these kids are coming in because they're suicidal, because they're like defiant or verbally or physically aggressive, because they run away. So those are the behaviors that we see. We have kids getting into like verbal and physical fights. They are aggressive towards staff. They are like active self harmers. They're having active suicidal thoughts. And if that level of care is too much for you, that's important to know because it can get really overwhelming sometimes. And there were days that I was like almost pushed to my limit because it's just a lot and it can be really overwhelming. I mean, I can remember like a client that we had who was just extremely suicidal to the point where they had to have like a staff with them at all times. And I remember I went to go talk to this kid and I went in their room, they're like under the covers, and there's a person sitting like less than 10 feet away from them. And like I pulled the cover back so I could talk to them. And they had been able to like rip a piece of fabric like off their shirt or something, tie it around their neck. And they were in there almost passed out with somebody like in the room with them. And I mean, that's a lot. That is a lot to walk in on, to have clients who are actively trying to hurt themselves. And like I can remember another client who would just get so overwhelmed with their thoughts that they would literally start banging their head on the wall to the point where it would bleed, or they would cause like they could have caused like serious damage if we hadn't restrained them to keep them safe. And if being in that type of environment where kids are getting into fights with each other or where they have to be restrained for their safety is too much for you, then that's really helpful to know because residential programs have a high staff turnover because of how stressful it can be. And I think sometimes we don't know how stressful it is until we get in it. But I think that's why these conversations are helpful because you can know what you're walking into or have a better idea of what you're walking into. But even with the stress, like I'm glad that I started out in residential because it showed me, like I said, what I can tolerate and what I feel comfortable tolerating. And I felt at this point, I feel like if I survive like working in residential for like a few years, then I can work in any environment and know that it's not gonna like push me to my breaking point. So pros and cons, pros and cons. But so after that, I started to transition into like the community outpatient setting. And that was just like completely different. And there's pros and cons to that too. So I learned that, some of the pros for me were that the clients had a lower level of care, um, and that I was able to work with more diverse clients. And when I say that, I'm talking about like their ages. So in the residential program, it was just 6 to 18. But in outpatient, I was able to start working with adults. And working with adults is different than working with kids. And I learned that I like working with adults. I like working with teens too, but the same things that you might do with teens or child clients aren't always going to work with adults. And so I had to learn different styles, different interventions, how to communicate with adults versus kids. And, I was able to just keep building up my skill set. And I was also able to try different things out to get trained or look into being trained in different modalities. And like I appreciate that too, being able to learn and to grow and to do different things. So like the biggest difference and the thing that I also appreciated was that working with adults is different in that most times it's their personal choice to be there. They're there because they want to be. And because of that, they bring in the things that they want to spend time on. And so I didn't have to do like as much planning out, okay, I'm gonna do this and then this and then this and then this. Because with kids, sometimes we need like activities or games or whatever it is. But with adults, if they're bringing in what they want to spend time on, I can be more client led and kind of just follow the direction that they're kind of taking me in and base what I do off of that. And so that honestly I loved. And that was great. But I feel like some of the cons for like community outpatient was one, the higher caseload. Um, I think the highest mine got to was 38. And I mean, I know people in like other agencies who've had like 60 plus clients, who have like 80 something clients. And obviously, they're not seeing all of them weekly, but that's a big number. Like, that's a lot of people to be keeping track of. And that just, community mental health can get overwhelming sometimes because of the need and because of how many people there are to be seen. Ah, but but yeah, so that was one of the cons. And also another con for me is just the kind of pressure to meet the productivity requirements. And I know different places call it different things, but productivity is kind of like the amount of clients you should be seeing. And that was a con for me because I realized that community mental health has a really high like cancellation or no show rate. And if clients aren't showing for their appointments, obviously I can't meet with them. Like I can do all the outreach, I can call, text, leave voicemails, do all these things, but if they don't show up, they don't show up. And I can't force anybody to keep an appointment. And that was another con, just the amount of people who don't show up for these things. And that was kind of stressful because there were times where I would feel like am I doing something wrong, or like are these people not showing up because of me? And at the end of the day, it's not. Like it's not because of me. I can't force anybody to do anything. But that's hard. It's hard to have a conversation. Like it's hard to have that conversation with your supervisor about why you're not meeting productivity, and well, what could you be doing differently when you feel like you're doing all the things that you can be doing. So that was like stressful for me and made community mental health a little bit harder. And also a con is that I feel like community mental health doesn't pay that well. And I know a lot of fields, a lot of jobs don't pay what they should, but for the workload, the amount of clients, and for just all the things that you have to do and stay on top of, I feel like the pay should be better than it is. Um, so yeah, there's pros and cons. I still appreciate like what I got out of working in community mental health, and I still do work in it. And I think there's a lot of room to grow and a lot of really great opportunities that you can have in that area. So pros and cons. But I also, like I said, have been doing contract work for private practice. And so when I say contract work, I mean I'm not a W-2 employee there. I'm a 1099. So technically I'm a independent contractor. And uh, so being a W-2 employee, you get like benefits. You work a set like 40 hours or whatever a week, and like you're an employee. But for a 1099, you're not. You don't have benefits. You don't have set hours that you work. So there's more flexibility, a little more independence. But also, you only get paid based off of the clients that you see and for how long you see them. So if you have like clients with certain insurances, if they don't show, you just don't get paid because you can't charge no show rates for certain insurance. But if you have private pay clients, then you can set like a no show fee. And so you can still get paid. Um, but I like that position that I have, the 1099, because I'm able to see how like a private practice works. I'm able to kind of have a better understanding of what goes into that. And if that's something that I'm thinking about in the future, like I have this information in the back of my head now. And like I said, I also like the independence and the flexibility of it. And there's like with all of these areas, there's pros and cons. And I know these are only 3 areas. Like there's hospitals, there's schools, there's, traditional private practice, there's so many different places and environments that we could work in as therapists. And I feel like these conversations aren't had enough. Like, I didn't even know a 1099 was a thing until I had joined like a Facebook group for therapists and I saw people talking about it. And I think the more that we kind of talk about these things, the more that we can make like better informed decisions about where we're working, the type of environment that we're in, what we're willing to tolerate and what we're not. And like obviously I know we get into this work because of the clients and because of, the work that we want to do with other people. But I think it's important that we're looking out for ourselves too and we're making choices for us. And that's a hard thing in like a helping profession. It's hard to kind of put ourselves first sometimes, but I think and I'm learning that it's important to prioritize like my needs and my goals. And I can't give all of myself to my clients if I'm not giving to myself too. And so by figuring out the type of environment that I want to be in, or just the direction I see myself going in, I'm able to work with my clients better because I know that I'm working in a place that kind of aligns with my goals and my needs. And at the end of the day, that's important. At the end of the day, I can only be there for my clients if I'm there for myself. So, so that's why I want to have these types of conversations and these discussions. So if you feel like it was helpful kind of hearing about these different things, like leave that in the comments, leave some likes, do those things so that way I can see that. But also, like I'm curious, like what type of environment do you work in? What do you think about it? What are the pros and the cons for you? And like, do you see yourself going into something other than that? And if so, where do you want to go? What do you want to do? And also, leave in the comments some other types of videos that you might want to see. And I can try to do some of those too. I know like I haven't done any review videos in a minute and I'm still working towards my independent licensure. So when I start studying for like the National Clinical Mental Health Counselor's exam, I'll do some videos on that. But that's in the future. So for now, I'm just trying to think of some other like topics that could be helpful for us to spend time on. I know in my last video I talked about like what helped me kind of improve my confidence when I was just starting out, and like how I approach just feelings of imposter syndrome. And like I said, I think these are the conversations that are important to have that I wish I would have had straight out of grad school. And the more we have these conversations, the more we can all just kind of grow and move in the ways that we want to. And that's the goal. So that's really all I had today. This is my second time recording this. So I hope it came out. I hope it came out all right. And, that's all I have. So I'm just going to finish my coffee and and just go from there.